He says, and I quote, "I have a good friend and some acquaintances who criticize me for complaining publicly about my struggles with my chronic illness. They'd prefer that I was much more stoic in the face of calamity of these adversities that have befallen me over the past several years. I am very grateful that I am still alive today due to the compassion of the generosity of relatives, friends, and acquaintances, some of whom were virtually strangers until they reached out. I can never thank them enough. This week, I was finally able to purchase 6 medications from which I paid $250 with, which I can continue treating the symptoms of heart disease. Last week, I also bought $95 worth of medications, knowing full well that 3 of them are only 2 to 3 week supply. These medications I must take daily, some twice daily, and some thrice daily. I am also receiving a supplement intravenously that costs $200 per vial, and of which I am to get 5 at a cost of $1,000. I also must pay $200 weekly for dialysis. My monthly healthcare bill is near $1,500, and this is without supplements or tests, examinations, consultations, and the like. Ours is truly a system where the rich will live and the poor will die prematurely because the standard of health care needed is unaffordable. Increasingly, I get angry as I see the gaps in the system where we can do better, much better. I do not want to lash out at anyone or anything, but I am frustrated and near irate at the slow pace of that change for the better." End of quote. Now, anybody that knows Glenn Tillett knows he, as I said to begin with, is no UDP sympathizer. He is a PUP, an ordinary PUP, who is facing the realities that we're living. He, like most Belizeans, are not living in this alternative reality that the PUP cabinet and members apparently are living in. But the reality is, he is not alone. Hundreds and thousands, if not thousands, of other Belizeans are facing this dire reality.